Are you struggling to help your child lose weight? New research shows a critical treatment option for childhood obesity is out of reach for many families. Reuters reports the gold standard for treatment, intensive behavioral counseling programs, often have long wait lists and limited insurance coverage. This comes despite nearly 20% of U.S. children being classified as obese. While new weight loss drugs show promise, some doctors are hesitant to use them on children without more long term safety data. We're going to bring in therapist Ryan Heapy. So, what's your take?
Yeah, it's absolutely shocking that in the span of 40 years, childhood obesity in this country has actually quadrupled. Not only are these behavioral programs hard to find and hardly accessible, but to be honest, I hadn't even heard of them before looking into this story, which says something right there. It's so difficult for us to change our habits. And if your option is either change your lifestyle or take this shot, which will soon be a pill, I can understand why so many people out there would take the far easier path, despite whatever potential side effects there might be. We really need an overhaul of the entire food industry if we're going to make any sort of lasting changes. When I look at Japan, and they have a 4.5% rate of obesity in their country compared to almost half of our entire population, there is something deeply flawed in the way we're doing things here. These ultra processed foods are literally killing us. And at some point, we have to say enough is enough. And I think our FDA, CDC, and NIH really need to step in, as these agencies are just as at fault as anyone else in creating this obesity epidemic.